Hello, hello, hello. Hi, everybody. Hello, fellow followers, viewers at home, lovely people that are always watching over to see what She Masters is bringing them. Let me take this opportunity to welcome you, to invite you to join me today on our program All About Care, where we talk about issues surrounding health and social care. Let me invite you now to call your friends, your family, everybody that has been saying, please make sure remind us that we should watch the program. We are here, and this is a makeup program because we missed the one that we're supposed to have on Friday. So we are having for that. So call everybody, call everybody, call everybody. Today we are going to be talking about uh you know what you should expect when working as a healthcare assistant. So keep on inviting others, take them, call them so that they can come and watch our program. It's all about care, brought to you by She Masters, and my name is Masako Zulu, and I'm gonna be taking you through this program today. If you have any questions as we go on with our program, feel free to put them there on the chat box, and I shall attend to them as we go on. This is all about care. All about care. So keep on inviting, sharing, calling them because we are here today to give you this makeup program for our program that was supposed to have been on Friday. So thank you very much for understanding and being there waiting for us. In the meantime, guys, let me know where you're connecting from. Masako Zulu, I'm talking to you from Dublin, Ireland. Let me know where you are connecting from. Who is there? Where are you connecting from? I'd love to hear from you. I'd love to hear from you as you continue to wait for others. So write down where you are connecting from and make sure that you share, you invite, you tag, you like the page as well. Make sure that you like the page. Hi, Miss David from Francistown. Nice to have you here. Nice to have you here. Make sure that you invite people. Make sure that you call others. Tell them that you are on. Please make sure that you tell them that we are on. Miss Davis from Francistown. Nice to have you. Nice to have you here. All about care, where we talk issues of health and social. 2 p.m. Botswana time. And today we are here to do the makeup program, that are supposed to have been on Friday. Who do we have here? Where are you connecting from? Kula Buinelo is connecting from Hojwane village near Serule. Wow. Kula will be coming to Palape. We hope to see you in Palape because you're in Serule. We'll be coming to Palape. Would very much like to see you. Would really much like to see people in Palape. We'll be in Palape very soon in May. The dates will follow, where we'll be having our healthcare program as well, where we'll be having our healthcare course. The classroom course, we'll be having it in Palape due to popular demand. We'll be having the other one in Gaborone, and the one in Gaborone is scheduled for the 22nd of May up to the 2nd of June. And then we'll be having another one. They'll be running concurrently. We'll be having another one that will be in Palape as well. Okay. So keep on inviting. Kemo Kiring. Oh my goodness. Kemo Kiring is connecting from India. So that's how we are global. We are global. We are not only in Botswana, we're in Ireland, we're in South Africa, we're in India, we're in the UK. We are everywhere. Thank you very much, Kemo. I wonder what time it is now in India. It must be very late, really, really late. Thank you very much for joining us. Thank you. Yes, so I was just saying that we're going to be having a full-time course that is going to be in Palape, and then we'll be having again in Gaborone, and we're going to be having an open day as well. Mind you, we have moved our office now to our permanent location in Block 5 Business Park, where we are in block 4, office 1. So please make sure that you pass by, you check on us, and get to see what we offer, what we have, and all that. Okay. So I'm going to start. This is all about care, where we talk about issues surrounding health and social care. Health and social care. Thank you very much, Kevonam, for joining us. So today we're asking the question, as we've been talking about what healthcare is all about, where you will be working as a health and social carer, what are the qualities of a health and social carer, what are the skills that you need to possess as a health and social care assistant, whether you call it a health and social care or carer or a nursing assistant. That's what we are looking at. Okay, so today we are going to be looking now as a health carer, what is it that you should be expecting to do within this job? Because we have a lot of people who be coming to us saying that, oh, I wasn't expecting to do that, I can't do that, I can do this, I can't do that. So we need to understand, going into this field, what exactly are you going to be doing? What are you expected to do as a health and social care worker, or as a health carer, or as a nursing assistant? Okay. One thing that I want to take forth is that I want you to all understand is that when you're working as a carer, as a nursing assistant, you are there to assist the nurses. And your main job is to make sure that you actually assist the clients or the patients or the service users with activities of daily living. You are there to assist them with activities of daily. You are not a nurse. You are not going to be prescribing any medication. You are not going to be any recommendations or that are medically. You are going to be there under the supervision of a nurse or under the supervision of a doctor who you'll be working with and all that. So you are going to be assisting your clients to actually promote their activities of daily living, to actually enhance their life, to be able to, to live independently, to promote them, to promote their well-being and all that. Okay, that's what you're going to be focusing on. So let's say that you work in a hospital, or maybe you work in a home care, or maybe we work with a client in a private practice with your doctor and all that. So that client is coming because they have a health need or they have a social need. Okay, so that client in the hospital, she can't feed herself. She has done an operation. She cannot go to the toilet because she has a catheter on or a stomach bag on, or maybe she's just been from an operation and all those things. Or maybe they are home. You are caring for somebody who's sick at home. They've been involved in an accident. Now they are home. Now they have to be doing the rehabilitation at home. And now you come as a health carer. What are you there to do? You are there to assist the client with activities of daily living. And what are those activities of daily living that we are talking about? So in the morning when you wake up, you know that you have to get up yourself. You have to brush your teeth, you have to prepare something to eat, you have to feed yourself, you eat, you bath yourself, you make your own bed, you go to the toilet, you get yourself ready, dressed up, and then you go to work, you do all those things. But now when it comes to a client, the client cannot do some of those things because maybe she's been involved in an accident, maybe she has a health condition that is not allowing her to do all those things, or maybe the client can come in to provide full care or partial care. Then you are there to meet up the needs that they need. Whatever they need, you are there to meet to provide that, because now you are assisting them in that regard. And after understanding what their need is. Okay, so if you have somebody who cannot walk, you are going to help them to move around. Maybe they're in their wheelchair. You are going to help them to move around. Maybe to go to the shop, drive them to the shop, or wheel them to the shop. Or maybe they cannot wash their clothes. They are sick that they cannot wash their clothes. Maybe they are bedridden. They're in the bed. You need to help them, maneuver around, turn, bath, and do all those things. So those are the things that you do. The things that you could be doing for yourself is what you're going to be assisting the client or the service user to do, because they are the things that they cannot do by themselves. So that is why I say you assist with activities of daily living. Daily living activities are the things that you could be doing every day. But because this one is a client or is a service user or is a patient, all those things. So they need assistance for you to help them to do those activities. So you assist with activities of daily living. So it can be, again, a reminder to take medication, maybe okay, I have to take my medication. You remind them, take medication, and the medication will be in blister packs where the medication are packed already for them. Okay, maybe sometimes we'll be having to monitor their BP, their sugar level, and all that, take their temperatures and all that. Those are the things that you'll be doing as a healthcare assistant. So generally, activities of daily living. Okay, so we go on. This is all about care, where we talk about what to expect when working as a healthcare assistant. And just be reminded that we have moved now to our permanent location, block unit 4, office 1, block 1. Sorry. That's where we are. And if you have any questions, if you have any comment, feel free to put them in the chat box, and I shall attend to them as we go on. So Bongani is asking if we have a diploma in palliative care. No, Bongani, we do not have a diploma in palliative care. We just have a short program in palliative care, which I believe would be very much enough, especially when you have done healthcare or you are coming from a healthcare background. You really don't need a diploma. You can do the short program, which is our short course in palliative care. Okay, feel free to contact us at 72784597. That's our office number, and we'll be happy to assist you. Blocks is taking Kef. Thank you very much. And then Kidirezi, I believe, is taking Masiho Mwalebe. Thank you very much. Okay, so we go on. So you are attending to the activities of daily living, making sure that you attend to the needs of the client. So you need to understand that every client will be different. Sepo would need this kind of care. Dineo would need this kind of help. Tumelo would need this kind of help. Some of them will need partial care. Some of them will need full-time care. And what they need, the needs that they have will definitely be different. So next time we'll be talking about providing person-centered care to understand people are different and we have to provide person-centered care. What do we mean by person-centered care? Okay. Today we are talking about the expectations, what you should know, your roles, what you are going to be doing when you are a healthcare assistant. Okay. So the person is at home, they cannot do anything for themselves. They cannot clean for themselves. They're just lying there and they are bedridden, or they cannot take the broom and do that. You'll be expected to clean. Okay. As much as you are at your house, at your home, you clean, you want to stay in a very good, clean environment. A clean environment, that means that we are eliminating, we are providing, providing what is called infection prevention and control. You don't want to be in a filthy place. If your client is in a filthy place, do you think they're going to be okay? They're going to recuperate from the whatever the illness that they're going through? No. And a filthy place is a place that breeds infections. We don't want that. So take a broom, sweep, be in a clean place, arrange your your utensils, arrange things in the house so that the place becomes safe again. So you don't want to wear pizza ile hale, stofo se le hale, mo le go hale go tlhakatlhakane go nkga go sa nna sentle ka ntele mo letse gare wa tsamaya wa kgopa wawa o mo okeletsa situation ya gagwe. Okay, so that is very, very, very important to make sure that you have to understand that you are going to be doing light house cleaning. So this would mean that you will be at at their homes. I get, even if you are not at their homes, you are in the ward or in the hospital. Hauri, you are leaving the cleaning to the cleaners. No, even you as a carer, you make things that you make wherever you have been, you show that indeed a carer was here. You are not only caring for them physically, but you are also caring for their environment. Make sure that you pack things nicely. After you take their clothes, you dress them up, you pack things in their wardrobe nicely. You open the curtains if they want the curtains. Always get consent from them. Always get consent from them. So open the curtains to make sure that the light comes in. And it gives them that, vava vomnyana. When you're in a good place, a clean place, you feel good. Imagine when you are coming from work and you find your bed messed up, so you want to come home to a clean place. They want to be in a clean environment, okay? And most importantly, infection prevention and control. So that is one thing that you should know, or that you should expect that you should be doing, okay? Whether you're at home, whether you're in the hospital. Number 2, companionship. Remember that physically sick, or they're physically ill or anything like that. Some of them, they're mentally, emotionally, they don't need just emotional care, spiritual care, and all that. As we have mentioned, the areas of holistic care, we said that we have emotional, the spiritual, the physical, the health wise, and all that, okay? So some of them, you'll be providing them with compassionate care. That is one thing that you're doing. This is where now you can just go and just be compassionate, be empathetic, just accompanying them, being there with them, companionship, being there with them, maybe taking them to the shop, maybe just sitting there and chatting with them. When you have people in the sabrana, sometimes you just don't need to give them medication, but to sit there and listen to them. That is companionship. Just sit there and listen. So those are the things that you'd be doing, some of the things that you'd be doing. You don't necessarily have to be working hard, doing hard work. No, sometimes you just go to a client, just a hand, just to hold their hand, to rub their hand, give them that, to say that I'm here with you, just to hold them and all that. Not holding in a sexual way, but holding in a compassionate way. Just especially the touch, the way we touch them tells a lot. The way we touch, when you touch somebody, when you touch me, when somebody touches me, I can tell what this touch is. Is it a sexual touch? Is it just a friendly touch, or is just a touch? Okay, so that is companionship that you'll be providing as a health carer. Okay, that is sorry, that is number 2. Okay, if you have any question, put them there. I'm going to attend to them. Thank you very much. Okay, then shopping. Sometimes you might need to do shopping for your clients. You need they can't go to the shop. You have to take them, you have to buy those, give you a shopping list. Just go get me something. When you're coming over, please get me 1, 2, 3, 4, 5, and you'll be going into their houses. That we are going to be talking about this next time. The security, the very importance of being in a client's house. Bogodu, indonyana tse disanyane tseo tse di ka kgonang go diragala tseo, di-temptations tse di ka nnang tsone. We're going to be talking about those things, how to prevent them and all that, and how to safeguard yourself and the client from those things. Okay, so the client o ka go kopa gore mo rekele sengwenyana, ha le mo rekela drink, dijonyana, tloape, and all that, and all that. Okay, so sometimes you'll be, if it is in that case, they'll give you money, or the relative will give you money, or you can use your money. If you have your money, then they will give you back your money. Okay, so it depends on the arrangement. The care provider, or maybe the organization that you are working with. Okay, so this one mainly would be kolapeng, but if it's in a hospital, then the arrangement will be done within the healthcare facility. Okay, then another important thing is that you are providing care to the client. Again, so this care that you'll be providing, it can be in a form of bathing the client. You can be bathing the client, and sometimes, like I said, depending on the need of the client, you can be providing full care or partial care. So if you are bathing the client and you are providing a full care, so all through the body and all that. And as you do that, how do you do that? You do that by communicating. You continue to communicate. You tell them that, okay, I'm going to wash your face now. Okay, Mary, I'll be washing your face now. I'll wipe your face. You wipe Mary's face gently, nicely, in a nice way. You wipe Mary's face. You wipe Mary's face. Okay, now you rinse the towel in clean water and all that. Okay, now I'm going to wipe under your breast, Mary. Okay, is that okay, Mary? Even if she doesn't respond or she does not come or whatever, make sure that you communicate. You tell them what you are going to be doing all the time. Don't get tired of it. You tell them what you are going to be doing. Why are you doing that? You are doing that because it's a way of getting consent. It's a way of letting them know the next step. You are taking them along. You don't want somebody and then what is going on? I'm not involved in this thing. Can't let the client becomes aggressive. We don't want that. So when you tell them, they are prepared, they know what is going on. It's a form of respect. You respect that person telling them what you're doing. You know, won't like it when somebody. So that is one for that you provide full care when so that those that can do some things, involve them. Those that can do some things for themselves, remember you are there to promote independence. Involve them. If o kgona go itlhapisa face, ask them, Mary, do you want to wash your face? Okay, okay, no, I can do it. You give Mary a itshutla face, a itshutla gongwe ga kgone go itlhapisa ko morago mme o kgona go itshutla gana wa mo lokela a itshutla. You let them wipe themselves and all that. Then you help them where they cannot do the good job. You help them there and telling them what we are going to be doing tonight. Is that okay? Is that okay? Always ask, is that okay? Getting consent from them. Okay, yes. Thank you very much. So we continue. I'll be looking at my chart. Let me see. This is all about care, where we talk about issues around the career of healthcare assistant, okay? And all other healthcare issues that we may come up with. Make sure that you tag, you invite, you share. Then if you have any question, any comment, put it in the chat box and I shall attend to that. Okay? Raditisa is asking if is this set BQ accredited? Yes, we are BQ accredited. It is BQ accredited, my dear. You can still go into the BQ website and check. We'll find us there. How long is your short course for care assistant, and is qualification rated by the UK? Our short course, our healthcare assistant course is actually from the UK or the Ireland UK standard. So they are adapted from that. Okay. So whatever that you'll be getting as care skills from here is what is in this course. So the courses are the ones that are aligned to the UK or the Ireland course syllabus for healthcare. Okay. Then the classroom that we are having, our short course is normally 2 weeks training, 2 weeks full training. Okay. And the 2 weeks, so sometimes, especially when we do it online, we make it that it's not like every day we attend class. It can take even 3 months, but making sure that it's a duration of the 2 weeks or maybe 14 days. So we'll be doing in blocks, so that we cover modules very well. Okay. So all in all, it will take you around 3 months to complete the course. All in all, to take around 3 months to complete the course and have your certificates. Okay. So now we're going to be having this course on full-time basis this coming May. Make sure that if you want to do it as fast as possible on full time, having to do the practicals, because we also do the practicals where you come in and then practice what you've been teaching, taking the theory into practice, taking all those BPs, using the commode, using all the equipment that we've been talking about during the training. Make sure that you do not miss registering for our May intake, which is going to be full time from the 22nd up to the 2nd of May. Make sure that you register for that program and you attend it. And we'll be having again dates for Palap. We'll be coming to Palap as well, so we'll be having dates for that. So where we need to have it as blended, because definitely it's going to be blended. It's going to be blended like that. So we'll be having the full time 2 weeks in Gaborone. Then from there you continue submitting your programs online and all that, and we'll be having the practical and the practical session as well. That one you should not ever miss. And this is going to be at our permanent location, or at our location in Block 5. All the details will be shared with you. And if you need to know more about this program, please do not hesitate to contact 72784597. 72784597. Anybody can enroll for this program, okay? Anybody who wants to enroll can enroll for it. We don't, no matter what background you are from, you can enroll for the program, okay? And then what we have, we're gonna give you a scrub when you enroll for this program. We're gonna give you a scrub. We're also going to give you we're gonna go to also assist you with making up your CV so that it meets, the employability standard of making up a CV for healthcare assistant, and any other opportunities that will be coming up. We're gonna be sharing them with you. Okay, we're a family. Okay, so connecting from Mochudi. Hi, thank you, Mposa Velo. Thank you very much for connecting from Mosh. Hi, Jacqueline, connecting from the United States of Molep City. Thank you very much. Kifilwe, assistant nursing. I don't understand your question. Assistant nursing, I don't understand it. Please elaborate on your question, Kifilwe. Is it full-time duration? If it's full-time, the duration, is it 3 months? Okay, our program in normal basis is 3 months. So whether you do it physically or whether you do it online, but we are saying that we have 2 weeks. We normally online will have 2 weeks or 14 days that we divide, or we spread across the 3 months, so that by the end of the 3 months you have completed the course. Okay, you have completed the course and you have your certificate. So that 2 weeks, that 14 days, we can spread it across the 3 months. Okay, then this time in May we will be having a physical class. The physical class will be from the 22nd up to the 2nd of June, the 22nd of May up to the 2nd of June, and we'll be having class from 9 a.m. up to 4 p.m. So full time for the full 2 weeks, and it will include also the practical. So after that, then you go back home, you write assessment, you do the exam and all that. Within 3 months, you should have finished your program. So we are not going to spread the classes across the 3 months and it takes long. So when it's full time like that, it's going to be 3 months and all that. And yes, it is accredited by the BQA. Okay. Kimberly from Zoa, the land of diamonds. Thank you very much. So we go on. This is all about care. We talk about what to expect to work as in healthcare. So we talked about cleaning, companionship. You can do light shopping as well, like I said. Then bathing, we've talked about that. Then meal preparation. Whether you're in the hospital, we know that in the hospital, they bring in meals. Then when the meals are there, not all clients would want to eat at the same time. If maybe at wherever they work, the organization or the hospital you are working at, maybe the meals are set, breakfast is set at 7 o'clock. Now from my house, I'm not used to eating at 7 o'clock. I eat at 10 o'clock. The kitchen brings in the food. Again, the kitchen staff brings in the food. It's your responsibility as a carer to make sure that if I don't want to eat at 10 o'clock, see how you can pack my food so that at 10 o'clock, once I'm ready to eat, then I can eat. Okay. So normally you'd have like kitchenettes or maybe pantries or some places where you can put clients' food away so that when they are ready to eat, they can eat. You don't want to force me to eat. You don't want to have issues with me as a client. Again, you don't want to have issues with your patient. You want to provide best care. You are there. That's why you are there, to provide best care. So you know that I'm caring for 5 patients, and this patient, this patient, okay, this ones I can do. So maybe if patient number 4 and number 5, baja late, so you assist them to bath while the others are having breakfast. Assist the other ones o ba tlhapise ba tlhape and all that ba nne ready bone ha ba sena go ja 10 o'clock o chaile then ba nela dijo tsa go you warm them in the microwave or wherever you want to warm them, you give them to them, you move on to the other clients who had been eating their breakfast, you help them as well accordingly. I get it. So you make the work easier for you and also for your clients. Okay. So at home, that's where you can prepare tea, toast, bread, porridge, and all that, eggs for your client, depending on what the client wants to eat. At the end of the day, you want that client to eat. She's not going to have medication as such. You want them to eat. You want them to have nutrients again. So those are the things that you'll be preparing. So don't think that as a health carer, you're going to be folding. You are a nurse. You're not a nurse. You are a health carer. You are a carer. You are caring. You are providing the care. You are assisting the client with the activities of daily living. You're providing care. You're providing what they cannot do for themselves. You're providing, if they cannot do shopping for themselves, they know not clean for themselves, they cannot buy themselves, you do those things. Okay? Then meal preparation, attending appointments. Sometimes you might be employed that you might be asked to take a client for an appointment. If it's at home, maybe you can come in and say, okay, go, you have an appointment, you're going from 10 up to 12 o'clock, you take the client for an appointment, then back, and that's it. Or maybe, all those times, maybe a wedding, accompany them to a wedding or to a social function or anything like that. So those are the things that you're going to be doing. So these are things I'm telling you guys, they are the things that you should expect if you want to come and work in Ireland, if you want to come and work in UK or abroad, or even there at home. These are the things that you should know as a health carer you are going to be doing. Okay, those are the things that you should know that you are going to do. Okay, I registered. Rati says, I registered for March. That means by June we will be done. Yes, if you have registered, remember it is for the short program. Okay, it is for the short course, the healthcare skills short course, not for the diploma. Not for the diploma or anything, because the other ones are longer, they take longer. So it's for the short program, it's for the short the basic course. Okay, yes, you'll be done by then, should be done by then. Okay, after the May, you should be done. Very you should be done, definitely you'll be done. Okay, then do you have nursing assistant, nursing, healthcare assistant, nursing assistant, health and social care, healthcare auxiliary, they're one and the same thing. You might call them differently, but it's one thing. So healthcare, this is our program for health and social care assistant. It gets you to be a nursing assistant. Wherever they call it nursing assistant, this is the course for you. Where they call it healthcare auxiliary, this is the course for you. Where they call it healthcare or care assistant, this is the course for you. Okay, so yes, that is the course for you, and it's PQA accredited. Okay, Miss Kimberly says, so as far as classes, it's only for those who are around GC only. Those who are on long distance, Badirajang, you have the online one. Okay, if you not come to GC or you cannot come to Palape, then you have the online one, which is still the same that you can do. Okay, we are just trying to get the physical one going. Okay, but we will be reaching different places looking at the demand. Okay, we might be going to Maui, we might be going to so many places. We want to bring services to you guys. We want to bring services to you guys, but it won't be like quick. So let's start bit by bit like that. Okay, so if you are in Maung and we say register, make sure that you register, because we cannot come for 2 people or for 5 people. We need to come for a large number, get the travel costs and all that. Okay, yes, ame a re we gone mo She Masters ha ke tlhaloganye the question, dear. Okay, elaborate on your question, then I'll answer you, my dear. Please do elaborate. Okay, elaborate on your dear. The cost of the course, the full-time cost is 4,500. 4,500. Okay, 4,500. That's the cost of the course. Okay. Yes, so we've talked about meal preparation, attending appointments. Now, I want to talk about the last bit. I want to talk about the last bit now of our program. Let me talk about the last bit of our program, the last very important part that is always scaring people, that is to provide continence care. This is a topic that we'll be talking about more again in our program all about care. I'll be teaching you about continence care. So most of the time when you are applying for a job, especially around here, I believe especially at home as well, the employer would be listening to hear or to see on your CV if you are comfortable with providing continence care. What is continence care? Continence care is the care that you provide to somebody who cannot hold their elimination, whether it's urinal or it's bowel. That is continence care. So the person who cannot hold their bowel movement, control their bowel movement or their urine flow, we say is incontinent. So continence promotion, you promote continence, you promote gore ba kgone go itshwara, ba kgone go controla di-muscle tsa bone ba ska ba na le di-accidents. I get. So that is continence promotion. So the employer would want to hear or would want to see in your CV if you are comfortable with that, because not everybody's comfortable with that. Not everybody wants somebody o mogolo kana mang e seng a ke re tlwaetse gore that care we give to bana ngwana monyenyana ga gore sepela wa dira latlhela ka ebile wa tšha a ke. But in healthcare, as a healthcare, that's your main area that you know that you should know you are going to provide continence care. You are in a hospital. People cannot do anything by themselves. You are not there to love to say that we're really number one, we're really number two. No. There's the language that you're going to use that we'll be learning in this program. All these things you'll be learning in our course. Okay. The languages that you use, there's a language that you use, the words that you use when you want to say that number one or number two. No, you don't say that. You don't say she pooed or she weed. No. We say open bowel, okay, or passed urine, okay, or wet themselves or wet, okay. So those are the things that will be elaborating more in the program, in the course that you'll be attending. So make sure that you attend the course so that you know more. So continence promotion is one of the things that you're going to be doing, okay. Then the thing is, how do you do it? How do I get to just wipe clean and all that? And how do I wipe that I prevent infections? I do not cause any transferable infections from one area to one opening to another. How do I do that in a dignified way? How do I do that in a respectable way? How do I do that to protect myself and to protect the client? Because kana ya no re tshwara di openings I get. So all those things will be learning them in the programs, in our healthcare programs. Please make sure that you attend this program. Make sure that you invest in attend, not only for work, but also for your well-being and also for caring for your loved ones. I did say this too. I'll continue to share my personal experiences. I did say that on the other program that, when I started doing healthcare, I cried the first time when I Tara, Andy or the Nikasia, the person that I was taking care of, because it was an elderly person. And the Nika had, or the Andy had a stain Nisa number 2, so the bowel, or just the stain, just a little stain. And I cried. I really, really cried. I really, really cried because I wasn't expecting that. It was my first time to see that, But as I continue to develop within the care industry, believe me, I love this profession. I love this industry. Why? Because I know very well that my mother will not suffer. The day that she gets old, the day that she's in hospital, my mother, my brothers, whoever that I'll be caring for, they will not suffer because I'll be there to take care of them in a good, respectable way, that they would feel loved when they get sick. Because that on its own gives them stress to say that and all that. But when you have knowledge, you have the skill, you have the competency of caring for people, now you don't feel so you don't even say you'll be doing that with pride. So you don't necessarily have to do the job, you don't necessarily have to do this course because you want to work. You do it for your own empowerment. That's why I want you, Botswana, to understand. You do it for your own empowerment. It's high time that we need to learn how to care for ourselves. We need to learn how to care for our parents. We need to learn how to care for our relatives. Give them that pride. This is why we give you the course, yeah, palliative care at S.H.E Master, to say that it is okay to know that somebody is dying. Then if somebody is dying, how do I care for them so that they go through their last days on earth of their life becomes lovely and enjoyable? Because what are you going to think about as a person? You're going to think about those horrible days. Hey guys, like and all that. No, it's not supposed to be like that. Let's give them love. Let's give our loved one love. How can we love them? Let's give them love. And these are our courses that we give, that we provide. They are there. They are for your own fulfillment. Don't just come and say that I don't want to be a carer, or maybe I want to work in the UK, I want to work in Ireland, I want to work in the hospital. Now I have to do the course. Do it now for your own fulfillment, for your own benefit. I became so passionate when I call, so emotional when I talk about this. When I talk about this course, this program, I love it. I really become so emotional. These things, that's the story that is inspiring. S.H.E Masters to continue to provide you with this program. So make sure, please make sure that the full-time program you attend it, because we are going to be showing you all the techniques, everything that you need to know, whether you have this or whether you have that at home. We are going to be going into your home. You'll be imagining yourself at home now doing all this. Okay, now, so that is continence care, that you are going to learn that in details, how to care, how to provide continence care when the person is bedridden, when they are in the bed, and when they are moving in the chair, when they are going to the toilet. How do you prompt that they do not have accident? That is what you're going to be learning in the program. Okay, so I'm gonna take my last comment here. Nake botsa gore how much is the cost, le gore e tsaya nako e kae. Sorry. Nna ke botsa gore how much is the cost, le gore e tsaya nako e kae. Is it BQ accredited? Yes, Precious Ntota, I've answered that. The course takes 2 weeks. It's going to take 2 weeks full time, and it's going to be in Gaborone full time. It is BQ accredited, and it's 4,500 for the full time program. Okay, for the full-time program, you are going to be provided with CV modification, CV clinic. You are going to be provided with a scrub. You're going to be doing again the practical on top of that. Okay, then you're going to be giving you a recommendation letter, so that when you finish, you go and look, if you want practical or anywhere internship, clinical internship, you have the recommendation letter that will be given you to do that. We can assist where we can assist, because places are full, guys, and all these infections are going on, things that we can assist, but we cannot get in time. So first come, first serve, and all that. We try by all means. And most of our students, run the courses are whether the back of friends stand back, they've been looking for internships for themselves with the recommendation letters that we give. They have internships. They are even getting employment out of that. Okay, so please rest assured. Let me see who's going to be joining us on the 22nd of May. Raise up your hand or send thumbs up if you are going to be joining us. If you are going to be doing that, definitely you'll get a goodie. You will get a goodie. Okay, make sure that you invite other people, you recommend other people to join the program as well, and feel free to contact us at 72784597. That's our number. And let's be here again and invite more. every Friday, 2 p.m. If ever we have an emergency like we did this Friday, guys, we will let you know. Literally, remember the climate scene, but we'll make sure that we make a makeup program like we did today. Okay, I love you with the love of God. Thank you very much for joining us. Continue to watch this program. Continue to watch All About Care, where we provide you with all the things that you, all the information that you need to know surrounding health care. With whether it's working abroad, whether it's working at home, whether it's doing it for, not for work, for your own fulfillment, we provide you with that. Okay. Thank you very much, guys. See you again this Friday as we're going to be giving you another lovely topic to talk about. Thank you and goodbye.